Okay, so we're ready whenever you guys are ready. Okay, so we're ready whenever you guys are ready.
Okay, thanks. Good morning, everybody. This is the Thursday, call this meeting to order, the Thursday, November 12th, 2020 Board of Health meeting. I'd like to remind everybody,
We're ready whenever you guys
that this meeting is being videotaped and also by audio. And pursuant to the governor's March 12, 2020 order suspending certain provisions of the open meeting law, any Nantucket public body that holds a meeting will do so via Zoom video conferencing. The video conference will be shown on Nantucket's Government TV YouTube page. We are now using Zoom webinar for meetings, which allows for the public to participate in the meeting as an attendee. Attendees must register to participate. The registration link is unique to the meeting. The registration link can be found in the description of the Nantucket Government TV YouTube live feed for the meeting. People registering to be an attendee must use their names, otherwise they will not be allowed to participate in the discussion. Attendees will join in listening mode. They can click the raise a hand button if they wish to speak. The chair will call on those who have raised their hands in order they were raised. If you do not have an audio capable device, the question and answer button can be used to type a question. The YouTube chat will no longer be enabled. Any questions that cannot be verbally asked must use the Q&A function. All questions should be directed through the chair. And for attendance purposes, when I call your name, could you just acknowledge that you were present? Malcolm Tab,
Present.
Meredith Lepre,
Present.
Melissa Murphy,
Sorry, I said here as someone cleared their throat.
we also have Select Board Chair Don Holgate
Here.
and Town Manager Libby Gibson.
Here, thank you.
And I think Jimmy Cooper will join us as soon as he can. He's said he still doesn't have the link.
Yep, I'm working on that.
All right, thank you.
Okay, so I'll just turn this over to Roberto to start.
Steve, did you want to take public comment first?
Sure. Why don't you see anybody's hand there?
Yeah. Yeah, I know Bill Greeter had his hand up.
Okay.
Bill, you're good.
Thank you. Good morning. Thanks for taking my brief, I guess, a statement, because I know if it's something not on the agenda, you really can't comment too much about it. But I wanted to put this forward for consideration for your next agenda. On the mainland, in October 2020, it's been reported that the leachate from the Rochester landfill that's being shipped to a wastewater treatment plant in Massachusetts and in Maine has been halted. It appears the PFAS in the leachate has compromised Lowell's water supply. In New Hampshire, the Department of Environmental Services found that 6 lined landfills have high levels of PFAS. In 2003, the Nantucket DPW developed a comprehensive wastewater management plan, including a Nantucket Water Protection District. Our landfill is located within this water protection district. In today's society, just about everything we use contains various levels of PFAS, and eventually it makes its way to our landfill located within that Nantucket Water Protection District. Leachate from our landfill is shipped to our Surfside wastewater treatment plant, and the resulting cake is returned to the landfill in a never-ending cycle. I understand Massachusetts does not require landfill testing for PFAS at this time. And it was reported in the Inky, and we've heard in various town discussions that the town has engaged a committee or research group headed by Chuck Larson for feasibility and scope of testing for other locations around the island. The water department's already completed some of their own testing on their wells. Given the potential health concerns relating to PFAS, it would seem that this issue should really move to the top of everyone's action plan. Given the size of the landfill versus what's at the size of the airport, shouldn't we be testing the landfill leachate now rather than wait for guidelines and testing? We could at least be getting the levels so that we have the information. So I'm asking the Board of Health to put this on your next agenda so that you can take some sort of action and make sure that you are in the process or the stream of information sharing here. Thank you.
Thanks, Bill.
Thank you.
Is this something, could we maybe make that an agenda item for next week's meeting?
You could definitely put that on the agenda for discussion. We have a risk assessment underway for PFAS, so it's always worth the discussion.
Absolutely.
So if you're listening, Bill, then we'll have that on there for next week to discuss.
Okay.
Any other hands raised?
I think we're good now.
Okay.
Okay. So one of the things that we've been running into is over the last 7 days or so. So let me pull up, actually, I have the email. Okay, never mind. For the last 14 days, the state has reported 57 cases for us, which is what they're going to be using for our designation tonight. Based on the information that they're giving, we're still going to be considered yellow because our 14-day positivity rate is less than 5% according to their numbers. However, our local numbers, what we use through the hospital, has our 7-day positivity rate above 5. So that is really in the yellow for us. That is getting, and it's really trying to push the limit for what we're able to handle. There you go, Jimmy. So as a result of the most recent surge that we're seeing, we discussed possibly rolling back to one of the previous phases for construction. I had contacted town council to help us merge our old previous orders into one new order. Thank you, Jimmy, for joining us.
All right, thank you.
It's all good. So Greg, I was just going over real quick what we're dealing with right now with the newest surge. And what we saw is that we're seeing a lot of clustering happening, specifically in people who are in the construction and landscaping community. And what we're seeing is people are getting sick. They're sometimes they don't know they're sick. Sometimes they don't know they're carrying. They show up to a work site with people who they're feeling comfortable. They have lunch with. Sometimes they're in the same trucks together without masks. And as a result, one person to one person transmission. And then that person goes home and they infect the people in their household. And unfortunately, we're talking about high density living. So sometimes when they bring it back to their household, that can be an infection of anywhere between 6 to 12 more people, depending on the size of the household, or if it's like what we saw a few weeks ago, where there were 3 houses in a row that shared a backyard. They all were together and all 3 households ended up sick, which was the initial spike. The original thought of what we should do was to roll all the way back to maybe 6 people per job site. And then as we discussed, we found there's more ways to work on it. So what I'm going to do is I'm going to go ahead and share the screen and show you what it is that town council has helped us write. So real quick, I know it's here somewhere. Here we go. So with the emergency order, this is the newest emergency order that town council has written for us, Greg. Greg Corbo said he's going to be a little late today, but he is going to join as soon as he can. but real quick, what we took the landscaping and the previous landscaping and the previous construction order and merged it into one. And what that does is what you see here. First step, when it says construction and landscaping shall comply with the sector-specific standards, the state actually has a significant amount of standards out. And I'm going so that I can post them here. What you'll see is these standards are actually really answer a lot of what it is that we're looking to do. Everything from the mask order, everything from the construction orders, the log books. So what we're finding, and there is also specific standards for small construction sites of one single family residences and things like that, including landscaping. So what we're doing is adopting these by reference in paragraph 1. And then in paragraph 2, we define construction and landscape job sites. And then in paragraph 3 is where you'll see the 4 mitigation standards. You'll see in subparagraph A where it says no more than 6 people. What we're suggesting today, we have been in contact with the Builders Association. They contacted me and they have some good ideas on how to also do further enforcement. So what we're suggesting is as staff is possibly removing the subparagraph A and discussing more of a phased approach that we can add to the agenda for next week. So I want to see what the board's thought is on this right off the bat before we move on to any of the other issues. So I can see everyone. So if you have any questions, just raise your hand. Melissa?
Thank you, Roberto, and thanks for that update. I appreciate the thought and consideration that you all have put in this over the first part of the week. And I fully support, and in fact, feel a bit remiss that I didn't know these safety standards were set by the state. And in some ways, I think I may have just assumed we had adopted them or were following them. So I support adopting these. I do not support right now, and I appreciate your recommendation of pausing on the limitations on job sites. And I just want to share with you a couple of reasons why I feel strongly about that. And the first one is, back in April and May, we had significant economic support on the federal and state level through unemployment. And I forget what those checks were called, the $1,200 that we received. But that we don't have that kind of economic support to support people who need to stop working. So to see and penalize an industry like that, we would have to have, I think, significant more cause from my perspective. But I do appreciate this sort of tightening up and working with the Builders Association, particularly to address small sites that are not perhaps permitted through the building department, where I see that is likely a large crack we can fall into in terms of enforcement and outreach and oversight. One question I did have was, would it be prudent for us to go back to registering those small sites like we did back in the spring? In my caretaking company, we would do that. We sort of plan out for the week what we needed to do and send that registration form in so that at the very least, the building department was aware of where we were working. And I wonder if that kind of registration system would be helpful to deploy again. But I thank you for this. I would recommend removing that limitation, but adopting these this policy without that for now.
Absolutely. And the registration, just like it was before, that's actually the subparagraphs B through D that I just highlighted. So we would be moving back to creating a COVID officer, registering the sites like before, and then that way it gives us that one-to-one connection, so we know who it is that's responsible for COVID regulations on site. And usually it was just, it was working really well but under the state's regulation, when we rolled back to the state, it kind of removed that specific COVID officer and assumed that it would be the foreman to the job site. So what we're doing now is just creating another, bringing it back to the COVID officer so that we know exactly who to contact.
Thank you. And Stephen, if I may just follow up on that, I think that's such an important idea because, you know, I think there are so many, we move so quickly. This is such a trade-based industry, and particularly right now, these small jobs, it would be really difficult to find out where people are. And I want to stress enforcement, but also just the outreach, having people be able to show up at job sites, have that COVID officer as a point person to communicate with, you know, maybe some kind of phone tree system through the Builders Association. I'm excited about your conversation with them because we do know this is a disease of personal responsibility, and as much as we can, as quickly as we can, to notify people when there is that start of a spread, to help them, support them in those mitigation efforts. I think that there's some good ideas and I'm excited to hear what the Builders Association has to say. That's all for me right now. Thank you, Stephen.
Any other hands that I can? Jimmy.
You know, I travel every single day. I must drive 30 or 40 miles every single day. I was in Sconset yesterday and going to check a house, and I drove up this street and there was 7 landscapers just redoing a lawn. It wasn't a building site at all. It was just for a private. There was 7 people. Every one of them had a mask around their neck, but only 3 of them had the mask on their face. So I drove by and then I said, you know what? I backed up. I introduced myself. I said, I'm Jim Cooper and I'm on the Board of Health. I said, who's in charge of this job? And no one said anything to me. I said, look, I'm going to give you guys 5 minutes to put your masks on. And if you don't, I think I have the power to shut this job down immediately. And so all of a sudden they put them on. And I said to one guy, I said, I don't understand it. You have the mask around your neck. How much of a job is it to just put it over your nose? And they just look at you. They just look at you. And I see it all over this island. I really don't have a problem with the building industry. I mean, maybe you can tell me, are there a lot of cases from plumbers and electricians and carpenters? Mainly, I see the problem is with landscapers, and I don't want to, you know, do anything with the building trade. I don't have a problem with that. Most of the things that I see are individual landscapers all over the island. People in sconces sitting down, weeding bushes and things like this with no masks on. And I'm sick and tired of going and rolling my window down and asking them to please put their mask on. And as far as I'm concerned, I think that's where the big problem is. It's between landscapers doing that and simple people walking up and down the street, and they just refuse to put the mask on. Thank you.
Thanks, Jim.
Yes, to answer your question, as far as the most recent cases go, it's been a solid mix between both construction and landscaping crews. It's been both. So any other questions that we're seeing here?
Yeah, are you saying that you think that we shouldn't limit the number of people on a job site?
Yeah, as of right now, limiting the people at the job site, because it's been one-to-one transmission on job sites, even if we have only 3 people on a job site, we'll still see the same type of transmission. So what the conversation that, or the emails that I was getting from the Builders Association that I also forwarded to you for review, they're discussing a different type of approach on how to answer that specific issue, which I agree with. So I think there's a better way to handle that. So what I would say is we should probably strike paragraph A, and then I can come back next week with a way to enforce it in a different way with
So
NBA.
But wouldn't limiting the number of people sort of help us get control of this versus waiting until it gets up to 10% and we have to shut everything down? Like, it just seems, and again, I'm seeing it from the school perspective of like, I want our students to stay in school. And I feel like if our numbers keep growing the way that they do or have been, like, why are we not taking a stronger stance now when we know like all of the college kids are coming home at Thanksgiving and our numbers are going to get potentially going to get worse if you look at what's happening.
No, absolutely. The only thing that we're, after discussing this with a couple other department heads as well, and also with some of the people in the industry, even if we do limit it down to 6, we're still going to see the same transmission that we're seeing right now. So what we're trying to see is that if we were to be able to pinpoint target issues using what the NBA is talking about, we can actually shut down a site easier that way, rather than blanket targeting the entire industry. Like, it's more of a precision strike than a carpet bomb. Melissa?
Thank you, Roberto. One question I had was for the COVID officer in those paragraphs B, C, and D. Is it worthwhile to have temperature taking happening by that COVID officer, similar to when you go to a restaurant? And I say that because I think you mentioned some people may be showing up to the work site sick or not feeling great, but don't know that they have COVID yet. Would that be another mitigation tool?
Yep, and subparagraph B that I just highlighted actually shows that they're supposed to be screened when they get there and they have to log it in.
Okay, so part of the screening is the temperature taking. Okay, great. Thank you.
I mean, do we put that specifically in there to say temperature taking or
I can add that.
and a specific attestation? Like, I have to fill out a online form every single morning before I come to school. And when I work at the hospital, every time I work, I have to fill out a form and get a cleared for work email before they will let me come in and work. I don't really know that temperature taking is itself is super helpful because people can take Tylenol before they come in. And I mean, we're not checking temperatures as kids walk into school because it's not really quite as effective, I think. But I'm a little bit more for limiting the number of people because I just think that would be more helpful. But
We can add a checklist on what to screen for. We can do a screening checklist. There's plenty of them out there. CDC.
I think that would be great because I think that there's more than just the temperature. If people have a cough, we send kids home. If they have a runny nose and a cough, they have to go home and get tested before they can come back. And I feel like if we're doing that to students, why are they not having to do something like that?
Absolutely. So I'll pull up a checklist, the CDC one, as soon as I get it. Jimmy, I think you had a question.
I do. Roberto?
Yes, sir. Yes, sir. Jimmy, you're good.
When we're talking about going back to the COVID officer, is that going to be a COVID officer for each trade that is on the job, or is it just going to be one individual that's responsible for the whole job?
It should be one individual who's responsible for the whole job site, for the specific job site. But sometimes, like you said, what happened in Wisconsin, where it's just a landscaper at one site without any construction present, that should also have, that specific crew should have a COVID officer logged in as well.
So on a big construction job, you might have a COVID officer for the plumbers, for the electrician, for the landscaper, for the builder, for the sheetrocker, for different trades, or would there be? Is that how it'll work?
We're hoping that it should be just the one COVID officer for the site.
For the whole site. Okay, thank you.
Yes, Melissa.
I have a couple of comments from constituents who had sent emails and asked me to read them into the record. And when it's appropriate, Steve, do you want to just let me know when I should do that? I want to make sure all the board members have a chance to talk.
Does anybody else want to comment on the beginning of this order, or are they limiting to 6? For myself, I'm going to agree with Roberto and just not, let's keep the 6 out of it for right now. And we can always, if the numbers get worse this week, next week we have to do something. We can limit the number of people next week. But I like what you're doing with it right now. But if anybody doesn't have any other questions,
I have a question. Do we have a threshold for if it gets to X% or X number of cases in a week that we would limit it to 6 people? I know that in the past 5% has been thrown around as if we get to 5%, then things are going to need to change. And we're at 5.1% and now saying that we don't need to limit it to 6 people. So is it when we get to 10%, I'm just curious.
Well, we're at 5%, which is why we're seeing an emergency order being brought up right now.
But not, I know, but not the limit of people. So I guess, is there a percentage that we would say, yes, we need to limit the number of people?
I think that would probably be best asked for the whole board. In my opinion, if we hit 10, that's island-wide closure.
Yeah.
If we hit 10%. But I want to see what does the board, or I know Don, you're on, Libby, Melissa, and Malcolm. So, Malcolm.
Well, I mean, I think this is fine. My concern is we're at 5%, over 5%, and I see no indication we're going to go down. It'd be interesting to see what the sewer systems numbers are, because I think when it's spiked last week, we certainly knew this was coming. I'm a little uncomfortable generally right now that I'm not sure what we should be doing more than just the landscapers and the building trades. With sort of because we can trace it there, it's easy for us to do. But I see, coming up at the end of the month, the farmers market with a lot of gathering of people. I'm just a little confused. I don't see consistency that we're going to let people have a big gathering at the end of the month, and we're going to come down on landscapers that is probably at this time is less work. So I have no specific answers. I just have concerns that we're not being consistent, and that at some point, I think we all have to realize, even before 10%, we're going to have to be a little more drastic. I'll support this order, but I think I'm glad we're meeting next week. We don't have to have special meetings, because I think we're going to have a lot to discuss.
An important part to note is that we are, by the state, limited to 10 already. No construction sites that have 10. That includes construction sites, the state limit to 10. That's all gatherings of all types. So it should already be limited to 10. So we'll need to be paying attention to that as well. Melissa?
I really appreciate Malcolm's comments. I do feel like there's a little bit of a sense of confusion in the community. And one thing I do think there's a lot of confusion, and you just noted the state order, about how the average person is to keep up with the differences between our order and state orders. For example, the state says you can have 25 people outside, but we're limited to 10. And, I always like to think I understand it more because I'm more intimately involved, but the average citizen, it can be difficult to track what's different between us and the state. And so I don't know if as part of our communication strategy, we could work on some kind of simple graphic that, or simple statement that helps us track what's in effect currently and what's not. With all due respect, when you go to any of the websites, and we keep one at the Chamber of Commerce also, and we're constantly trying to make it a little bit easier to read, but just following the history of the orders is not easy for the average person to do. And I think now we've got a lot of information for people. Meredith's absolutely right. People are coming for the Thanksgiving holiday and perhaps staying longer. College students returning home. I know we're working on messages about how to return safely to Nantucket, how to travel safely to Nantucket. All of this has to be done in coordination with the industry notifications because the information is just overwhelming. And that, frankly, I think adds to the sense of COVID fatigue. I know we have personal responsibility to pay attention and track all of these things, but I think as leaders in the community, whatever we can do to make that information more digestible for everyone is going to help a lot. And I'm with you, Meredith. I kind of go on the fence about right now, whether to restrict or not. But like Malcolm, I take good comfort that next week we have a meeting scheduled and we have this written and ready to go. If we need to do further restrictions because this targeted approach isn't working, then we can do that. But my hope is that we don't have to penalize, a broad section of our industry for the, I want to say misbehavior of a few, but for the actions of a few.
Don?
I support where you're heading with this right now. I don't support the limitation on people at the moment. I mean, like you point out, it's already limited to 10. And it seems to me from the information that I have that a lot of the spread has been very much attributed to people who are very comfortable with each other, whether socially, family, and that's where we need to target more efforts just in terms of education. I very much support these going back to having a defined COVID officer, keeping logs for the contact tracing, and putting in more checkpoints with the support of the Builders Association. I'm very concerned that we have more things that will be coming down towards us as things spike throughout the country. The Biden administration is already talking about the potential of a full nationwide lockdown in the middle of the winter. So I think that we need to be cognizant of that and allow people to continue to support their families and get things buttoned up in such a way that they can right now, because it may get a lot worse. I'm concerned.
Oh yeah, it's getting worse. It's getting worse across the country.
It is getting worse.
Yeah, I want things really to be attributed to where they're coming from, and the 6 is a bit arbitrary at this point.
I guess, targeting where it's coming from has sort of been our policy, but it's always been sort of retrospective policy. At some point, we have to be a little more proactive, I think. So I'd really like if Roberto can think about it maybe next week.
Mm-hmm.
I mean, what happens when we get to 6% and 7% and 10%? Because I think we're just, treading water here. I think if you look at the numbers, it's not going to get better.
Yeah, no, the 10% was where we had already originally set our threshold. That's part of the original metrics we voted in back in April, I think. 10% was the threshold for starting to shut down specific, targeted things, targeted industries. Going back to curbside pickup, going back to, certain amounts of people on a job site, no more than X amount. So yeah, no, that's the 10% is our local threshold that we had brought in. So what I'm going to go ahead and I found the CDC checklist. So I just popped it up on the screen here. So what we can do is we can have this as the screening tool that they use for all the job sites. It's already made, it's already there. We can just add it in as, you know, maybe as an appendix to this, so that they can have that screening tool. But the other part,
Roberto, again,
yes, sir.
I'm sorry.
Yes, sir.
Mr. Chairman, may I speak?
Yes, go ahead, Malcolm.
Is it, why should this checklist just not be available to all workers, all industries on the island? In my little job, I actually have to fill one out as well.
Mhm.
We make this mandatory across the island. You can't come into work unless you've screened. I'm just trying to get ahead of this before we're sitting here again, locking doors.
I would suggest making a different order for that if we're going to
Yeah.
make it mandatory across the entire island, and that's something we can probably discuss. I can probably get town council to help us write up an order for that for next week.
Yeah, I would
Just
appreciate that.
so we can have that available. This is just a screening tool, and if a CDC has a version of this electronically that they allow you to embed on your own websites, on your own computers, things like that, and download your own data. So what we can do is use that so that instead of they don't have to keep paper copies of this at all times. This is a PDF, and if you have Adobe Acrobat, you can actually alter this yourself and save it in, so you can have electronic copies as well. So it is a very useful tool. The QR codes at the bottom of the screen, at the bottom here where I'm circling, those are ways for you to embed it and put it onto your own website and have it electronically. So yeah, we can definitely look into doing that as an emergency order.
Melissa?
Would it be helpful to have maybe a Zoom session for people who are the COVID officers? Maybe just a half-hour session through the Builders Association where you get sort of a training in keeping your logs, what the expectations are, how to do a test screening for your employees or your subcontractors. Something like, we know that bartenders have to be tips trained, for example. So with that kind of, I'm not necessarily suggesting they need to be certified to be a COVID officer, but I think as part of training and outreach, that could be really helpful.
Absolutely, I can get in contact with them and see what they're willing to work with us on and go forward from there. I can see if maybe we can get a representative from the Builders Association at next week's meeting as well.
That would be great.
One thing that is also really important for all of us, for everyone at home watching as well, and I know this is broadcast on TV and on YouTube. Yes, we're having a really rough moment, and Massachusetts is as having its highest it's ever had. But I also want to draw attention to how it is across the United States. New England, in general, these lighter colors that you're seeing on the top, on the Northeast, is going to show that we're actually by far better than the rest of the United States. Massachusetts, as we zoom in, is a little bit darker because we're a much more major metropolitan area. But even with that, Nantucket is still in very good shape in comparison to the rest of the state. So it is also very important that we're seeing that. This may not be where we are 2 weeks from now, but as of today, this is where we are. And that's also really important for all of us to see because of people moving indoors, this being the winter. As you'll see in the colder areas of the country, we're getting a lot darker into that purple. So it's just something to keep an eye on for everyone when we're at home. If anyone's traveling for Thanksgiving, we're going to be working with the hospital to see if we can expand the asymptomatic testing to supplement that stop the spread that we have, to stop the spread testing for after Thanksgiving. So thank you, Greg, for joining us. How are you doing? Oh, Greg is there. So Greg, I see, so Town Council Greg Corbo just joined. Just to give you a heads up. So Greg, we're looking to maybe strike subparagraph 3A, the limitations for the work site, and then just add a specific screening tool to 3B. If the board wants to discuss any more, let me know.
I do have a couple of public comments from people. If you don't mind, just let me know the right time to read them in, Steve.
Yeah, I mean, if you go ahead, might as well.
So the first one is from Burton Ballkind, and he asks, as a one-person landscape contractor, what responsibilities, if any, do I have to follow these guidelines?
Well, Spruce Burton, I think you're, as a one-person show, you are your own COVID officer. So you are responsible to wear your own mask, especially if there's more than one person on the site. And we would appreciate it if you do still need to screen yourself before you show up to sites. But it's we all on the town, when we go to log into our computers, we have an informational packet pop up on our screen before we can log in, explaining that we have to screen ourselves and check ourselves for symptoms. I would say that's the same for a one-person show.
Okay, I had another one from Stephen Thoreau, who's works at Nantucket Architecture Group, and he wrote, sort of in summary, I cannot tell you how many people I pass on the road, 3 or 4 in a vehicle, maskless, or the number of landscapers mowing lawns with no masks on. Throwing a big COVID blanket on the trades is not really fair. Transparency needs to be noted so we can see which trades need to perform better. So I think that's just a comment likely in support of your targeted approach right now. And I may have one other from Amy Eldridge, but I'll wait to see if it comes in.
Well, Amy, I see you're signed in. Would you want to speak? If you want to, you can raise your hand.
She mentioned to me she's listening at work, so
Okay, that makes sense.
How that goes, but
okay. So then, as we go, let me see. Let me see. So we do have a couple comments that came in through the chat, actually. So we do have a chat from Chris Kinsley Hancock that says, the light up sign near the hospital is easy to read and attention getting, more of them in more places perhaps. So that's something similar. We could put more signs up. I know we've been trying to get a lot of signs out there. And then Frank Daly, curious if the board would read into the record the suggestion from the Nantucket Builders Association.
Yeah. Do you want to read that, Roberta?
Yes, I can read that. So give me just a moment. I would need to.
Roberta, while you're looking for that, or Steve, I do have a question from Amy. And maybe while you're looking for that email, I could pop it in.
Yep. Sure.
She asks, what is being done to help those that are being asked to isolate due to positive tests or while their tests are pending, to help them get groceries, etc., and to educate them on limiting contact with people?
So we do have a list of that information, and I know I've been working with Taylor at compiling a nice thing for that. So what we're going to do is get that up on the website as soon as we can. Once we have that all compiled into one nice document, we can also email it out to the trade associations and groups like that. I'll get that over to you at the chamber as well, using your chamber hat.
Thank you.
So we can once we get that into a one document, because this question was brought up earlier this week with some of our cases, so we started working on that as we could. One issue that we're also running into is people who are having problems with other types of help. So, Nantucket food and rental assistance, the PPP loans, I forgot what it stands for, that sort of thing. So we're trying to compile some of that information too. So to read into the record, the NBA meetings. So let me see where we are. All right, so here we go. The Nantucket Board Builders Association suggests that reintroducing the more rigorous COVID log, handing out comprehensive protocols to everyone on site, including movers, design professionals, owners, and adding a 3-tiered strike system are all procedures that the NBA would fully support. Perhaps the last suggestion would be first, implementing a swift and decisive 3-tiered strike threshold for all job sites, permitted or not, would be the most effective. We see this as the first strike as an infraction resulting in a fine, the second infraction resulting in a 1-day shutdown, and the third strike resulting in a 2-week shutdown. The third strike would also trigger additional inspections on that contractor's other job sites. The Nantucket Builder Association knows we are past the point of having the first strike be a warning, past the point of anyone saying that it won't happen again. We need to be proactive and unilaterally stringent, as we understand we are on the precipice of all tradesmen across the island being greatly restricted or potentially shut down because of unprofessional and dangerous actions of a select few. As we race towards colder weather, the holidays, and the end of the year, and our tradespeople needing to stay steadily employed to cover their holiday and year-end expenditures, there is no better time than now to present a clear path forward for those that want to do the right thing, stay working, and keep themselves and others safe, versus those who are only thinking about what is convenient for them at that time. We thank you for your outreach and your steady hand on the wheel, and look forward to connecting with you when your schedule will allow. Sincerely, the Board of Directors of Nantucket Builders Association. So let me see if there are any other chats that have popped up. Okay, so there's that, and then I don't see any more. There is a hand raised. Mary?
Is it possible to maybe, when you get that list together, to maybe be giving it to people as they're getting tested, that the hospital could give out something? Because I do think it's important, and I know that everyone probably tells people this, but I do think it's important when people come to get tested that they know that they should be isolating until they get their test results back. Because I got that question a lot of people figuring they'd get tested and then just go to work the next day. And so I think along with giving them information, maybe it would be important to give them the information about rental assistance and what is available when they get tested.
Okay.
Because it may take days before they get the results. I mean, people who got tested on Monday got the results yesterday. So
yeah, with the large spread across Massachusetts, the Broad Institute is starting to get a little stretched on their turnaround. No, that's a good idea. And once we get that list together, we can get that out and printed, and we can get it out at the testing sites. I'll talk to, I believe it's Chris Glowacki who's overseeing the drive-through site. If it's not him, I'll have him point me in the right direction so I can get that to people. It's a good suggestion. And then with that, I think we've discussed the COVID officers. So moving over to paragraph 4, it's just what the effective date will be. If we decide to vote this in, we just need to set a date on when that would be effective. This would be effective. Any person, paragraph 5 is saying that they're subject to the random inspections. Paragraph 6 is the responsibilities of a COVID-19 safety officer. Paragraph 7, it's the maximum penalty. Penalties will be issued to both the company and a specific person violating the protocol. It allows for both. Paragraph 8 is the authorized agents, which is us, the designated police officers, if they But once again, don't forget the police officers, our primary duty is education first. So we hear on occasion, why aren't the police doing this? Their primary duty is to educate. This is the last step for them.
Before you move on,
Yes, sir.
Part of that, I think Jimmy, talking to you yesterday, wanted to maybe bring something up.
Yes, I talked to the sheriff. I see him every morning at the post office. And I was talking to him about this, and I said, well, you have the right to do this, to give tickets and things. And he says, no, I haven't been told that I have the right to do it. And I said, well, at our next meeting, I will make sure that you are included as someone that can. He said, I could give 8 or 9 tickets every single day. He walks around town all day long. And I think he should be, able to do what he should do. And he tells me that, I guess, I don't know, you have to discuss it with him, Roberto, or what does he do to be one of the officers that can ticket people?
Greg, if you're on, do you think, can we just add the sheriff as a agent on this, on paragraph 8?
Good morning, everyone. Sorry I couldn't join earlier. In response to this question, yes, we can add the sheriff in under paragraph 8 and from the town's perspective, delegate that authority to him. However, he may need to check with his counsel as to what the authority of the sheriff's office is to participate in enforcing local regulations.
In the meantime, can we just add him on here, and then if his counsel says no, it's kind of severable?
Absolutely. My recommendation would be to add him in, and then if it ends up not being used, it ends up not being used. But at least it's there. And if he does have that authority, then it is another tool in your toolbox that you can take advantage of.
Mr. Chairman,
Go ahead, Libby.
I just was going to suggest perhaps, Greg, that it could say sheriff subject to whatever state rules and regulations apply to him. He is not a local enforcement, agent. He's an agent of the state.
Yeah, no, I understand that. That's why I had suggested that he should check with his counsel because I don't know that he has what his scope of authority is. And so maybe we could put some qualifier in there, sheriff or deputy sheriff, and then in parentheses, to the extent authorized by law.
Yes, exactly.
Okay.
Perfect.
And then paragraph 9 is, we're adopting chapter 21D. Paragraph 10 is what the maximum fine under 21D is. And Melissa?
Thanks, Roberto. I can hold my comment until you're done reviewing this. I'm sorry, I forgot you were going through that.
Nope, no worries. It's just one more paragraph, which is paragraph 11, which under the criminal disposition, if we choose to go that way through district court, the maximum penalty can actually be $1,000 at that point. So, and that's it.
So my question is just to follow up on Meredith's request. We will be putting something together and or working with the hospital to give people something when they're tested about when it's appropriate to go back to work or back to school, pending their test results, and a list of resources available to help them should they need resources. And then I guess my follow-up to that would be, would that also include if you need assistance for a place to stay, if you do get COVID positive and you cannot stay in your home, due to the inability to isolate, do we have resources to help people with that?
So as far as the isolation and quarantine question, can you actually ask that one again?
Sure. So the first part of my question is, are we working, based on Meredith's comments, will we be working through the human services side and maybe perhaps in conjunction with the hospital to create something that are given to people when they're tested that tells them to isolate until the test results come back, and all of those suggestions? And then the second part of my question is, if people are positive and have to isolate and they cannot do so at home, do we have a place of referral or support for those folks?
So with the first part of the question, definitely we're connecting. Tomorrow is Taylor's last day. So I'm gonna try to get as much as we can out of
It's
it.
fast.
Yeah, maybe we can squeeze a little bit of blood out of the stone on that. But we're trying to get that out as soon as we can. But yes, once we get that together, we can get that out so that people can get it when they come in and get tested. As far as a kind of convalescent home for people who are sick or where they can go, fortunately, we don't have the ability to do that. We don't have the resources to do that. That is, we looked into it. That is something that was looked at extensively, and unfortunately, it just wasn't feasible for people who can't isolate at home. We couldn't find a location for it.
Melissa?
Just as a follow-up to that, I wonder, I don't know when you looked into that, Roberto, but the landscape of operations of inns and hotels is very different now, and I wonder if it might be worth reinvestigating because we aren't in the height of even our shoulder season anymore, and perhaps there's locations that we can identify that would be willing to support people. I can't imagine the numbers are great, but in this instance, if they do require assistance isolating, what happens? Where do they go?
Yeah, no, absolutely. The last time we looked into it was actually the week after we had the 2 deaths. Those ensuing 2 weeks after that, we looked into it, and it just wasn't working. I can open the inquiry again and take a look. It's a difficult situation. A lot of people aren't willing to call themselves an area where they're accepting COVID positive patients. In the meantime, when people can't isolate at home and they're living in a communal housing, we do have a staff member, Madison, who is going out to these communal living situations with guidance in multiple languages from the CDC, with masks and hand sanitizer, the care packages that the hospital gave to us, describing how to isolate at home and in a communal living situation, using those guidances. Unfortunately, by the time we find out that a person is positive, they have already infected the people in their household. They get tested as contacts, and they're coming back positive as contact at that point. Like every single case that we've had, almost every single case that we've had at the schools actually happened that way. Somebody brought it home, didn't know they were positive until they got tested. By the time the contacts got tested, the entire household had already been infected. So it's becoming a little bit, it is difficult. But we did have a few cases. We actually have a couple cases right now where I've spoken to the family, where yes, there's a person who is sick in the household and was able to isolate within the home, and nobody else has they've gotten 2 tests, one as a contact, and then they wanted to get a confirmatory negative this week, and everyone else in the household is still negative. Because the person was able to isolate successfully at home. So we do get them guidance as we can, especially in the communal housing.
I think this is going to be a big issue as we head into the winter. And, I'd be happy to, if I can, help you and the department work on it in any way, Roberto. I know how much is on your plate. So if that's something that I could support you on, I'm happy to. I'm very concerned as we head into the winter and see these spikes increasing. We need to have a plan for how to help people who can't safely isolate or stay sick in their homes if they're in a shared living space. We may be able to handle it sort of case by case right now, but I do think we need to have a bit more of a strategy because we are seeing cases rising and we are moving into the colder months.
So absolutely, definitely. And one of the big ones that has been popped out is, sorry, I said popped out. One of the big people who have been helping us a lot is actually a big shout out to Janet Schulte, because she's also been really helpful at getting individual information out to businesses. So thank you. So we'll definitely be in contact on how to get as much information out as we can.
Any more questions for Roberto, or you want to move to getting a motion to adopt this new order? Melissa?
All right, Steve, there's a comment from Frank Daly in the chat, and I think this is really important to read and clarify.
Okay, so it's gonna take me a few seconds. Could the board please clarify the current limit of people on a job site? The state regulations, as far as I see, states the following: indoor gatherings at private residences and in any other place not falling pithing the definition of an event venue or public setting, limited to a maximum of 10 people. Outdoor gatherings at private residence and in any other place not falling within the definition of an event or venue as setting or limit is limited to a maximum of 25. Does that mean a job site can have 25 outside and 10 inside? Actually, technically, I believe yes. No. So he said, sorry, I talked too fast. Siri changed the home words. Gotcha. Not failing, not hiding, sorry. So actually, Greg, could you clarify that for me? At a work site right now, could it be 10 people inside and 25 outside according to the state guidelines?
Thank you, Roberto. My understanding is that those gathering guidelines do not apply when there is state-specific guidance for a particular sector. So in this case, the state has guidance with respect to construction sites, and I don't believe that those guidances have a limit on how many people can be on the site at one time, as long as they are wearing masks and social distancing and following all of the other safety protocols for construction sites. Roberto, I sent you those state guidelines yesterday. Did I miss something there in terms of a per person limit?
Nope, I think you're right. I did post it earlier. I showed it earlier, and I have them. Let me share my screen again so that we can see them. So these are the state guidelines. So you're absolutely right. I think earlier I had misstated saying that they were limited to 10 based on that, but you're absolutely right. I forgot that there was site specific on that. So thank you, Frank, for bringing that up. So this is what the current construction sites have to deal with here. We'll put this out on the packet today so that you will have it available on the website on the Board of Health packet for today's meeting. Anything else? We don't have any questions, no hands raised. So Steve, I'll throw it back to you.
Okay, any other questions before we move to a vote?
Would we have this start today?
Go ahead, Melissa.
I'm
ahead.
so sorry. I just want to make sure, back to the information that's being passed out at the testing site, that we ensure it's translated. I know that it's easy to assume that it would be, but I just want to make sure that that is part of the process.
We always translate it to English and Spanish at a minimum. The other languages, we don't have a certified translator for that. So we can't put our names behind it, our liability behind that, any other translations beyond that. But we do always translate it to English and Spanish at the minimum. And Meredith, I know you said something earlier.
What would be the date? Did we decide on a date? Like, does this take effect starting tomorrow morning? Does this take effect next week? I mean, I don't think we decided on that.
Nope, I don't think we had decided on that. So I can go ahead and I'll pop this back on the screen just to do a quick review. We're striking the 6 people limit, adding the CDC checklist. I'll get that to Greg so that you can see that, and so we can throw it in. Adding the sheriff and deputies to Nantucket County to the extent authorized by Massachusetts state law. And then we need to set a date.
I mean, tomorrow it's short notice being Friday tomorrow. You wanted to start on a work day with that, the 16th?
That Monday, I think. Yeah, it's Monday the 16th.
Yeah, Monday the 16th. I don't know how the rest of the board feels.
Regardless, we would need a vote on the whole order, and we would need a vote for and we can throw in the date, effective date. So I'll leave that up to the board.
Does anybody have any other dates in mind? Tomorrow, Saturday?
I don't see why we don't just start it tomorrow.
Whatever.
I just think we need to get ahead of this and this at least start something more.
Yeah, I mean, the dates doesn't really matter to me. I'm fine with Friday the 13th. So, actually, can I get a motion to make the date Friday the 13th on the new construction landscape order?
I'll make that motion.
I'll second.
Mr. Chair,
Yes. Go ahead,
Mr.
Greg.
Chair, this is Greg Corbo. I noticed that there is a time in there of 12:01 p.m. That's probably just a holdover from a prior order. Do you want to have this start at the beginning of the workday, like 7 a.m., or at some different time as well?
I would say 7 a.m. of the workday.
Sorry. I just realized I forgot. I canceled the screen share. My apologies. That would be. It's 7 a.m.
7 a.m. Yep. So I'll get a motion to accept Friday, November 13th, 2020 at 7 a.m. as the start of the new construction landscape emergency order.
So moved.
Okay, got a second?
Second.
Okay, all in favor by roll call vote. Jim Cooper,
Yes,
Meredith Lepre,
Yes.
Melissa Murphy,
Aye.
Jim Cooper,
Yes.
and Steve Visco says yes.
Forgot me.
Oh,
Yes.
Malcolm McNabb.
Yes.
Okay, thanks. Can't see everybody right now. That's it.
Second, let me stop.
David,
Go ahead, Melissa.
thank you. I think I see a question from Will Stevens to the panelists to repeat when and where the updated ruling will be published. But I think I'd also suggest that we send this out to the Builders Association so that they can distribute to their mailing list as soon as possible, since we are enacting this for tomorrow morning.
Yep, we will post this as soon as we have it finalized. I'll get that posted on the website under the emergency orders section. And then, yes, we can email it to the NBA and the other associations that we have emails for.
Okay, so now on the motion to accept the new emergency order, can I get a motion for that?
So moved.
Take a
Second.
Okay, all in favor by roll call as I see you, Jim Cooper,
Yes.
Meredith Lepre,
Yes.
Malcolm McNabb,
Yes.
Melissa Murphy,
Aye.
and Steve Visco says yes.
Okay. I think that's Melissa.
Melissa?
I'm just full of it today, aren't I? I do have a question from Select Board member Christy Ferrantella. She's traveling, and she asked if the CDC guidelines that you referenced, Roberto, which are the checklist for an employee to sign off on, is that for all businesses or at this moment, or are we just asking that of the construction trades right now?
As of right now, this order is just for the construction and landscaping. As Dr. McNabb mentioned earlier, we would like to see that for every business on island moving forward, but we would need to draft that as a new order.
Great. So we can talk about that next week.
Yes.
Thank you very much.
So Greg, I'll be emailing you shortly.
Sounds good.
Are there any other concerns from the board? Malcolm?
Yes, thank you, Mr. Chairman. Roberto, what is our false positive rate?
I do not have that information. I can look for it.
I don't know if we have enough to really determine that, but it's been our policy. We just accept everything as positive.
Because it's the most conservative way. Once we get when we get a positive test from a PCR, which is the gold standard, so usually it's less than 6%, really on a large scale. It's better to treat yourself as a true positive, no matter what, than accidentally think it's a false positive.
Right. So we've done like 12,000 tests, or
So we should.
There's some, but we don't know.
Yeah. So we've had about 200 or so. I'll pull it up in just a second.
That's all right. It's just a scientific curiosity more than anything else.
Theoretically, we shouldn't have any more than about 16 false positives,
Right.
Because we have 251 positive tests.
Your math is quicker than mine.
Melissa?
Thank you, Steve. To Roberto, through you, do we have a sense on why the state did not want to increase the limit of our asymptomatic testing from 75 to 150?
No.
Okay. I know we've only hit that 75 target. I think I heard Jason Graziadei from NCH 8 times since we've had the Stop the Spread campaign here, but I'm just curious what the resistance would be in a community that's seeing surges. Is it confirmed that we have that testing through November 30th and we're trying to extend that beyond the 30th? Did I hear you say that?
Yes. So we do have it until the 30th right now, but we are looking to extend that further. We are technically the only county that doesn't have a full-time Stop the Spread in the state of Massachusetts. So we're trying to fight that a little bit to make it permanent.
Great. Let us know if you need support to advocate for that.
Sounds good. Thank you. Right now, we've been working with Julian Sear and Dylan Fernandez's offices, and they've been really fighting for us on this one. So we're trying to see where we go.
Any other questions for Roberto before we adjourn? No.
I'll make a motion to adjourn.
Okay, can I get a second?
Second,
All in favor by roll call vote. Jim Cooper,
yes.
Meredith Lepre,
Yes.
Melissa Murphy,
Yes.
Malcolm McNabb,
Yes.
Steve Visco says yes. Okay, thanks for everybody for coming in this morning, and we'll see you next week.
See you next week. Thank you.
Thanks.